Hello, everyone, and welcome back to the Insight Room, where we understand the mind one insight at a time. Before we get started, this video is for educational and entertainment purposes only and should not be considered medical or mental health advice. If you're concerned about your own symptoms, please consult a qualified healthcare professional. Have you ever walked away from a conversation and wondered, why does this seem so much harder for me than it does for everyone else? Maybe you've struggled to make friends. Maybe social situations leave you exhausted. Maybe you've been described as shy or awkward, quiet, or different. Or maybe you've spent some time online and started wondering whether autism might explain what you're going through. If so, you're not alone. Today, we're going to compare three conditions that can sometimes look surprisingly similar from the outside: autism spectrum disorder, social anxiety disorder, and a lesser-known condition called Social Pragmatic Communication Disorder, or SPCD. We'll discuss the symptoms of each condition, how they overlap, how they differ, what different levels of severity can look like, and what treatment typically involves. Let's start with social anxiety disorder. This is a disorder characterized by significant fear of being judged, embarrassed, rejected, or negatively evaluated by other people. The important thing to understand is that people with social anxiety generally understand social situations. They usually understand social rules. They often know exactly what they want to say. The problem isn't understanding the situation, the problem is fear. Someone with social anxiety may worry, what if I say something stupid? What if everyone notices how nervous I am? What if I embarrass myself? What if people think I'm weird? Because those fears, social situations can become incredibly stressful. In addition to emotional distress, people may experience physical symptoms such as sweating, blushing, trembling, nausea, muscle tension, or even a racing heart. At a mild level, someone might feel anxious before a presentation, a first date, an interview, or meeting new people. At a moderate level, they may begin avoiding parties, networking events, group activities, or social situations where they could be evaluated. Or at a severe level, even everyday interactions such as making a phone call, ordering food, asking a question, or speaking to a cashier can become extremely distressing. It's also worth briefly distinguishing social anxiety disorder from avoidant personality disorder. These conditions can look similar on the surface because they both involve anxiety, avoidance, and concerns about rejection. However, there are more important differences. Someone with social anxiety disorder often wants to attend the party, make friends, speak up in the meeting, or ask someone out on a date. The difficulty comes from the fear of what might happen. They may worry about being embarrassed, saying the wrong thing, looking awkward, or being negatively evaluated by others. Someone with avoidant personality disorder often experiences a deeper and more persistent belief that they're inadequate or likely to be rejected by others. A person with social anxiety may think, what if they judge me? But a person with avoidant personality disorder is more likely to think, people probably won't like me anyways. Both conditions can involve anxiety and avoidance, but avoidant personality disorder tends to affect a broader range of relationships and aspects of life. The pattern is often more pervasive and tied to how a person sees themselves rather than specific social situations. We'll discuss avoidant personality disorder in much greater detail in a future video, but that's helpful for a distinction for now. Now, let's move on to autism spectrum disorder. Autism is a neurodevelopmental condition characterized by persistent differences in social communication and social interaction, along with restricted or repetitive patterns of behavior, interests, or activities. One of the biggest misconceptions about autism is that it's simply social awkwardness. It's much more complex than that. Many autistic individuals experience differences in social emotional reciprocity. In simple terms, the natural back and forth flow that social interaction has, and it may be more difficult for them. Some individuals have difficulty reading facial expressions, understanding body language, recognizing social cues, or interpreting others' tone of their voice. Others may struggle with understanding implied meanings, sarcasm, indirect communication, or unwritten social cues many people seem to pick up naturally. Autism can also involve sensory differences. Certain sounds, lights, textures, smells, crowds, or environments may be experienced as much more intense or overwhelming. The second major area of autism involves restricted and repetitive patterns of behavior. Examples may include highly focused interests, repetitive movements, repetitive speech patterns, strong preferences for routine, insistence on sameness, or significant distress when plans unexpectedly change. At a mild level, someone may appear socially unusual, miss subtle social cues, prefer predictable routines, or have highly specialized interests. At a moderate level, social communication difficulties become more noticeable and may significantly affect friendships, education, employment, or daily functioning. At higher levels of support needs, communication and adaptive functioning can be substantially affected, often requiring ongoing support across multiple areas of life. One of the most important distinctions between autism and social anxiety is that social anxiety is primarily driven by fear. Autism is primarily driven by differences in social communication, understanding, sensory processing, and behavioral patterns. Now, let's talk about the condition that many people have never heard of: Social Pragmatic Communication Disorder, SPCD. This involves persistent difficulties with social use of communication. People with this often struggle with the practical side of communication. For example, they may have difficulty adjusting to how they speak depending on who they're talking to. They may struggle with taking turns in conversation. They may miss implied meanings. They may have difficulty understanding sarcasm, humor, metaphors, or indirect communication. They may also struggle to stay on topic or understand the social context of the conversation. From the outside, SPCD can sometimes look very similar to autism. In fact, there is one reason why comprehensive evaluations are so important. The biggest difference is that individuals with SPCD do not demonstrate the restricted or repetitive behaviors that are required for an autism diagnosis. In other words, they have social communication difficulties, but they don't show the broader patterns of symptoms that defines autism spectrum disorder. Now, let's talk about where things get complicated. All three conditions can involve social difficulties, awkward conversation, challenges with friendships and relationships. All three can result in social withdrawal. All three can leave someone feeling misunderstood. Imagine 3 people decline an invitation to a social gathering. The first person stays home because they are afraid of being judged. The second person stays home because social situations feel confusing, overwhelming, or difficult to interpret. The third person stays home because they struggle to understand the flow of conversation and the unwritten rules of communication. The behavior looks almost identical. The underlying reason is completely different, and that difference matters. As clinicians, we're not simply checking boxes. We're trying to understand the entire picture. We're looking at developmental history. We're looking at symptom patterns. We're looking at social functioning. We're looking at how long symptoms have been present, what are some aggravating factors or alleviating factors, and we're looking at what best explains the person's overall experience. This brings us to another important point. Not every socially anxious moment is social anxiety disorder. Not every communication mistake is a communication disorder. And not every strong interest is autism. Most people feel socially anxious from time to time. Most people feel nervous before a presentation, a first date, or an important conversation. Most people occasionally miss social cues, misunderstand another person's intention, interrupt someone accidentally, or have an awkward interaction. And most people have hobbies and interests they're passionate about. Clinicians diagnose patterns, not individual traits. The diagnosis is generally considered when symptoms are persistent, create meaningful distress, interfere with daily functioning, or represent a broader syndrome rather than an isolated characteristic. Finally, let's briefly discuss treatment. For social anxiety disorder, treatments often include cognitive behavioral therapy, exposure-based interventions, and sometimes medication. The goal is typically to reduce fear, reduce avoidance, and increase confidence in social situations. For autism spectrum disorder, treatment is usually focused on support rather than cure. Depending on the individual's needs, interventions may include occupational therapy, social communication support, educational accommodation, skills training, sensory accommodations, and helping individuals build on their own strengths. For social pragmatic communication disorder, treatment often focuses on improving social communication skills. This may involve speech-language therapy, pragmatic language interventions, social communication training, and structured opportunities to practice communication in real-world situations. As we wrap up, I'd like to leave you with one final thought. When we see a behavior, it's natural to ask, what diagnosis does this belong to? But often the better question is, why is this behavior happening in the first place? Because two people can look very similar on the surface while experiencing something completely different underneath. Understanding that difference is often the first step towards understanding the mind. Thank you for watching. If you found this video helpful, consider liking, subscribing, and letting me know in the comments what mental health topic you'd like to see covered next. And as always, thank you for spending some time with me here in the Insight Room.